unanswered questions. It doesn't mean you failed. I mean, you can, basically it's a 70%. You can actually unanswer 30% or get 30% wrong and still pass, roughly speaking. But don't leave it blank. Sometimes you maybe narrowed it down to 2 choices. At least pick one of the 2 you narrowed it down to. So then you have a 50-50 chance of getting it right, okay? But don't get deflated if you can't figure out the answer. Just let it go, move on, next. The idea is to pass, not to get 100. Do we have any overthinkers in the room? Yeah, that's a killer for board exams. Remind yourself that you're taking a board exam. You're not really doing coding per se. You're not getting a real chart to code. You're getting a scenario or a blip or a concept that they're testing you on, okay? Right now, my specialty is radiology. If I got a radiology question, I would tend to overthink it. Oh, yeah, that's that tissue one where they do this and da-da-da-da, and and Medicare said to do this. I'm going to overthink it. I'm going to read too much into it. Oh, they're trying to trick me. No, they're not. They're trying to test you on your general understanding of the coding principles for that section. Okay, so take a step back. Don't overthink it. Okay, take the question at face value. Okay, if in the blip they say it was a complicated repair, take that at face value. If the code definition is for simple versus complicated, go with the complicated one. Don't go, well, they said complicated, but really this doesn't read like a complicated repair. No, because it's a scenario. They didn't give you all the gory details of all the work that went into the repair or whatever. Okay, so if they use the buzzword, take the buzzword, plug it in, and move on to the next question. Okay, don't overthink it. And what is your job when you take the board exam? You're not coding. Your job is to pick the best of the 4 possible answers. That's your job. And I'm gonna keep asking it throughout the day. What's your job? To pick the best of the 4 possible answers, okay? And the more you sound that down, the better prepared you're going to be to take that board exam, okay? They give you 4 answers. So you don't need to read the scenario and try and code it and then go see if it's one of the 4 answers. You don't have time for that. What you want to do is look up the 4 answers and compare them to each other, probably throw out 2 of the 4, and then see what the difference is between those 2, and then go extrapolate that from the scenario. You'll know what you need to find once you look at the answers, okay? Don't make it harder on you than you need to. Yeah, so comparing and contrasting the answers. What I recommend, so when you're doing surgery questions, sometimes scenarios can get kind of longish, right? And our inclination is to go read the scenario and then go look up the answers. Well, when you're reading the scenario, everything seems important. Oh, I'm going to need to know that. Oh, they're mentioning size. I'm probably going to need to know that. Don't do that to yourself. If you can make yourself do it, go look up the answers first. Normally, they're within a couple pages of each other, okay? And in your booklet, you can write in your booklet all you want. Write down the gist of what makes those codes different. Maybe 2 are upper extremity, 2 are lower extremity. Maybe 2 are for simple repairs, 2 are for complicated. There's something that's going to jump right out at you that's very clear that makes them different. Okay, jot it down. Now, go read your blip. Now that you know what the differences are in the answers, you know exactly what you're trying to pull out. And it'll jump right out at you. Okay, B and D are out. It's got to be A or C. What's the difference between A or C? Measurement. Let me go back and get that measurement. Let's see. Okay? Yeah, I'm making it sound a little more simplistic, but that's the idea. Now, you can't always look at the answers first, like with medical terminology. You got to read the blip first, okay? But for the surgery type questions, and even E&M, you can go through and come up with the level and everything, but it's a lot better if you look at the 4 answers and then you realize, oh, they're testing on that I understand that this is a consult or not, or that this is in the emergency room versus this setting. Then you don't even maybe have to worry about that leveling. Why go through all that extra work when that's not what they're testing you on? Okay, so by looking at the answer, you really get an idea of what principle they're trying to test you on. Okay. Okay, this is where we're going to talk about marking up your books to draw your attention to logical groupings. Okay, this is like what my whole method is based on for teaching. So, for example, let's turn in our CPT books to page 57 for the 2010 version, or code 10021, the very beginning of the surgery section. Okay, I call it bubbling and highlighting. I used to have some students who were very anal, and they would get a ruler, and I'm like, don't be that crazy, okay? The idea here is, in looking at code 10040, and by the way, as I start teaching, when we're on the same page, I'll say code 040 or code 060. It's just shorthand, so you understand what I'm doing. Because this code doesn't have anything underneath it that's indented, this is called a standalone code. Okay, it doesn't get a bubble. Okay, but the next two codes, the 060 code is a parent code because it starts with a capital, right? And then 061, there's a space, there's an indentation here. Okay, so that makes this an indented code. There's nothing else underneath it, so I bubble those two together. They go together. Okay, I use pencil because you can make, bubbling errors. But if you want to use pen, you can, but I recommend you use pencil. And then the next bubble is the 080 to 081. And what I'll do is I tend to bring in any parenthetical notes below it. 99% of the time they go with what preceded it. Okay, but sometimes you have to read it a little bit and go, oh no, that actually goes with what follows, once in a blue moon. So bubble that in any parenthetical notes, okay? And then in the next column, we've got the